Hello everyone, welcome to my YouTube channel. In this video, we will discuss about diabetes. You may be a diabetic patient, maybe you are still not have diagnosed with diabetes. Anyway, diabetes is a disastrous medical condition. If you get diabetes, then there are a lot of complications in line to occur in near future. But if you diagnose with diabetes, the best way is to take proper treatment to prevent having complications. But if you are still not having diabetes, then you are still having a chance to prevent diabetes. But how can we prevent diabetes? So the focus of this video is to educate you regarding how to prevent diabetes. First of all, I think it is better to know how we can early detect diabetes. So, to learn that, the first thing we should know is the clinical features of diabetes. So, I will tell you mostly the diabetic patients in the early stage are asymptomatic. They don't show any of the clinical symptoms or signs. So, they don't know that they are having diabetes. But sometimes, if your blood sugar level is high, you can develop these clinical features like you need to urinate often, you may be having intense thirst, you may be having blurry vision. So, remember these three symptoms: increased needing to urinate, intense thirst, and blurry vision. So, if you have any of these symptoms, then it may be an indication that you are having high blood sugar level. So at that stage, it is better if you can check a blood sugar level. So what are the tests you can do? Obviously, you can meet your doctor and prescribe some investigations. But you can do these blood investigation. The first one is fasting blood sugar, and the second one is HbA1c. So fasting blood sugar we measure, we keep the patient fasting for 8 to 10 hours. You don't need to, you should avoid taking any foods for 8 to 10 hours overnight, and take blood for blood sugar level early in the morning. Go to a laboratory and take blood before the breakfast early in the morning, and they will check your blood sugar level. So that is called fasting blood sugar. So the fasting blood sugar value will give you some idea about your blood sugar status. If it is less than 100 milligrams per deciliter, then it is normal. Then you can be happy about. And if it is between 100 to 125, you are still not having diabetes, but you have a risk of having diabetes in near future. We call that condition pre-diabetes. So, if you are having pre-diabetes, then you should take the appropriate measures to prevent having diabetes. So, this is a good good chance for you to have, because then you know that you are having a risk of having diabetes. Then you can actively take measures to prevent diabetes. So, I will tell what are those measures later. And if the fasting blood sugar value is more than 126 milligrams per deciliter, then you have diabetes. So you should meet a doctor and take appropriate treatment to prevent the complications. Apart from fasting blood sugar investigation, the other investigation I will tell you about is HbA1c level. Here HB means hemoglobin. So we check hemoglobin A1c level. This is a very good test. The basis behind this test is when our blood sugar level is high, the glucose interact with our hemoglobin and forms glycosylated hemoglobin. So we measure how how many percentage of glycosylated hemoglobin is there in our blood. So if it is high, it means that our blood glucose level is high. If it is low, it means that our blood glucose level is low. The advantage of this investigation over fasting blood sugar is because that the lifespan of hemoglobin is around 3 months. HbA1c measures our blood sugar control around 3 months duration. So this value gives a rough idea about the average blood sugar control within past 3 months of anyone. So this test can be done regardless of the meal. Even after taking meal, we can do that. And the interpretation can be done like this: if HbA1c is less than 5.7%, it is normal. If it is between 5.7 to 6.4%, it is pre-diabetes. If it is more than 6.5%, then it is diabetes. So here also, if it is normal, you can be happy. If it is pre-diabetes, you can take appropriate measures to prevent diabetes. So these two tests you can do if you think that you may be having diabetes. However, I told you initially, although you can get these symptoms, most of the time the patients in this stage are asymptomatic. So even if you are asymptomatic, do you need to check a blood sugar level? So I have mentioned here few risk factors. So if you have any of these risk factors, even if you are not having the symptoms, it is better to check the blood sugar level. So what are these risk factors? If you are overweight or obese, so it is one risk factor. And if you are having low physical activity, if you are doing a job sitting all the time in the same chair and you are having a sedentary lifestyle, then it is an indication to check blood sugar level. And if you are smoking, and also if your close relatives by your bloodline is having diabetes, and also if you had diabetes during your pregnancy previously. So if you are having any of these risk factors, then it is better to check the blood sugar level. So you can do these two investigations and check the blood sugar level, whether it is normal, whether it is in the pre-diabetes range, or whether it is in the diabetes range. So that is how we can early detect diabetes. Assume that you are having pre-diabetes, or else you are having normal blood sugar level. So what I am going to tell is more important about those who are having pre-diabetes, but this is also important for those who are having normal blood sugar level, that you are still having a chance to prevent diabetes. There are three main steps which we can do. The first one is healthy diet, the second one is appropriate physical activity, and the third one is quitting smoking. So the healthy diet, you can eat something like this. So you can divide your plate into 4 quarters, and 1 quarter fill it with whole grain or starch vegetables, and 1 quarter with lean protein. You can lean meat, lean fish, anything you can take. And also you can fill the other 2 quarters, so it amounts to 1/2 with non-starchy vegetables. So this is a good plate for a person to prevent having diabetes. So we remove the we reduce the amount of starch and increase protein and vitamins and vegetables. And also we can take a small amount of fresh fruit, and also skim or 1% milk we can take. So a plate something like this you can take as a healthy diet. And also one important fact is to try to take 2 or 3 main diets a day and avoid the diets in between. So it is also a good habit to control your blood glucose level. And physical activity. So physical activity, you can do 30 minutes exercise a day for about 5 days a week. So the recommended duration of exercise per week is around 150 minutes per week. So you can do a low intensity exercise like walking, cycling, dancing, swimming, something like this. So you can do this exercise 30 minutes a day, and by doing this you can reduce the risk of having diabetes in future. And the other one is quit smoking. So you can take these three measures and change your lifestyle according to this, then you can prevent diabetes and live a happy life.